Assalamu alaikum wa rahmatullahi wa barakatuh. Today's topic sort of came up during a discussion with the family yesterday, and I agree that we need to talk about this topic because it's something that people need to understand because people who are suffering from various types of mental illnesses need not only our compassion but also our support. So, again, this is a topic again very close to my heart and one that I have encountered on so many different levels and situations. Uh, Again, let's talk about the topic and hopefully you will take away some lesson from it, and we all need to change our behaviors in certain ways. Bismillah ar-Rahman rahim. So, we are going to talk about the invisible struggle. Why mentally ill individuals often lack the support that they desperately need. So, uh, in the realm of human health, physical ailments often evoke sympathy, assistance, and immediate attention. A person with a broken leg is surrounded by concerned friends, family, and co workers. Someone undergoing chemotherapy is showered with support and understanding. However, when it comes to mental or psychological illnesses, conditions like depression, anxiety, bipolar disorder, PTSD, or schizophrenia, the story is vastly different. Because these illnesses lack visible symptoms, they are often misunderstood, underestimated, or even dismissed entirely. The invisibility of mental health disorders makes sufferers particularly vulnerable as they are forced to battle their pain in silence and isolation, often without the emotional, social, or even medical support that they need and deserve. The invisible nature of mental illness. Unlike a bleeding wound, a swollen ankle, or a feverish forehead, psychological ailments present no outward sign. The pain is internal, emotional, and frequently hidden. A person battling depression may smile at a gathering while dying inside. Someone with anxiety may perform well at work or school but crumble in solitude due to incessant fear and worry. This invisibility makes mental illnesses easy to ignore, not just by others but often by the patient themselves. This silent suffering becomes even more complex because psychological illnesses can manifest in behavior that others misinterpret as laziness, moodiness, irresponsibility, or rudeness. A depressed individual may be seen as weak or unmotivated. A person with panic disorder might be labeled as overly dramatic. Those with post traumatic stress disorder may be accused of living in the past. These misconceptions further alienate the mentally ill and prevent them from receiving empathy, compassion, and necessary support. Lack of awareness and understanding. A significant reason mentally ill individuals do not get the support they need is the widespread ignorance about mental health. Many people, especially in conservative or traditional societies, fail to grasp that mental illness is just as real and debilitating as any physical ailment. Mental health is often trivialized or seen as something within one's own control. Just snap out of it. Think positive. It's all in your head. These are the common responses that reflect a lack of education and empathy. Additionally, many cultures attach stigma to mental illness, equating it with madness, weakness, or even moral failure. This stigma not only prevents patients from opening up about their struggles, but it also discourages family members from acknowledging or accepting the issue. As a result, patients are often left to suffer alone, sometimes even punished or shamed for behaviors caused by their illness. The psychological toll of being unsupported when mentally ill individuals are not supported, the consequences can be devastating. Isolation, loneliness, and feeling of being misunderstood often deepen the severity of the illness. Patients may begin to believe that their suffering is invalid or unimportant. This can lead to further emotional deterioration, self harm, substance abuse, or even suicide. Support is more than just a comforting presence, it is a lifeline. A depressed person needs someone to remind them that they matter. An anxious individual needs reassurance, not ridicule. A trauma survivor needs validation, not skepticism. Without these, patients may never seek therapy, may not adhere to any medication, and may lose all hope of recovery. Systematic and even institutional neglect. Beyond the families and social circles, institutions also fail mentally ill individuals. Healthcare systems in many parts of the world, including the West, are ill equipped to handle mental health. There's a shortage of trained professionals, psychiatric services, and mental health awareness programs. Even insurance companies often treat mental health differently from physical health, thereby limiting access to proper treatment. Workplaces are often unaccommodating, failing to understand the need for mental health days, flexible hours, or therapeutic leave. Schools do not have sufficient counselors to identify or address psychological struggles in students. Legal systems often treat mentally ill individuals harshly, or they fail to consider their condition during sentencing or detention. All of these factors make it incredibly difficult for sufferers to live dignified, stable lives. The, the need for empathy and support. True support for mental illness begins with empathy, a deep, non judgmental understanding that the pain someone is feeling, though invisible, is real. Families must educate themselves, avoid stigmatizing language, and encourage open conversations. Friends should learn to listen rather than offer unsolicited advice. Communities must offer safe spaces for those struggling mentally. Governments and institutions must also take concrete steps like increase the funding for mental health services, uh, train professionals, integrate mental health education into school curricula, enforce anti-discrimination laws, and ensure parity between physical and mental health in insurance and medical policies. Support groups, peer networks, and online communities also play an invaluable role. Sometimes knowing that someone else understands your struggle can be enough to keep going for another day. Let's summarize. Mental and psychological illnesses are often termed as invisible diseases, but their consequences are painfully real. The absence of visible symptoms makes these disorders easy to ignore and difficult to diagnose, leading sufferers to endure their battles alone. As a society, we must recognize that emotional pain is just as valid as physical pain. The need for support, whether emotional, financial, or institutional, is not a luxury for the mentally ill. It is a necessity. By offering understanding, compassion, and tangible assistance, we can transform the lives of millions living in silence and despair. In doing so, we also elevate our collective humanity. Please share this video among your family and friends because this is a topic on which people need more awareness. Assalamu alaikum wa rahmatullahi wa barakatuh.